Hi, I'm Angie Weidinger, and I'm joined by Dr. Cameron Chrisman Robbins.
Hello.
And we are at the Women and Infants Center, and that's at the Barnes-Jewish Parkview Tower. And this is a really exciting time because we're getting a little bit of a sneak peek before it has its grand opening.
Yes, I keep telling people as I'm around the floors a little bit more as we're preparing for our move on Saturday, I'm practically stopping people in schnooks, like, have you heard? Have you seen? Do you know how beautiful it is? So this is a really, really big week for our service.
It's so exciting because this is a special partnership between Washington University Physicians, Barnes-Jewish Hospital, and St. Louis Children's Hospital. And we'll get into what makes that partnership even kind of a physical partnership between the location of things a little later. But you're with Washington, you're a OBGYN with Washington University.
I am. So I'm part of the crew that takes care of women having their babies, and you know, our move for labor and delivery is coming up, as I mentioned, on Saturday. There are other folks as part of our sort of wider partnership who have already moved into the new building.
So let's talk about why. I mean, we're excited about it because people have been dreaming and talking about this for years, hoping that St. Louis could get something as special as this is. Mm-hmm. And now it's a reality. Let's talk a little bit about what makes it so special.
It is special for the first thing that you'll see if you come into the building, and I hope you do, is how beautiful it is. If you believe that healthcare is and wellness is a part of a package of how we feel in our physical environment, and especially when we're ill, what our physical environment is like, the people caring for us, the space, the light, the colors, you will walk into this building and be completely floored that it is absolutely gorgeous. So it's light, there's art, there's colors, there's beautiful, soothing, it's a soothing space. And I don't think we could say that about our old labor and delivery, which did really well for a lot of years, but now we're creating a new space.
When you can dream it, you dream for the best,
yes,
right?
Absolutely.
I mean, this is a delivery room where we are. When
I walked in,
I would not have guessed that. I would have guessed that this is where moms come after, but no, this is it's so comfortable in here.
It's spacious. We have the capacity to provide really high quality care, sort of handling those what if situations. If somebody has a rough labor, if they have complications with delivery, if somebody's recovering from a really uncomplicated delivery, this is the room. It all happens here.
Well, we want to talk about what you do when you get here if you're in labor. But first, I want to remind people that if you have any questions, the greatest thing about Facebook Live is you just comment those and we'll answer them, or she will answer them for you. So, okay, so if a woman is in labor, what does she need to do? Where does she need to come? How does she check in? What happens?
If you're in labor, you can come to the Circle Drive in front of this building. There is a valet that will take care of you.
Nice, good.
You just get out of your car and you take the patient elevators up to the 5th floor. So there are 2 stacks of elevators in the main lobby, and one of them is very clearly marked for women and infants portion of Parkview Tower. So you go up those elevators to the 5th floor, and we are here. There's no way to get lost. The elevator doors open, and you see our administrative staff there to welcome you with a smile and help figure out from that point what you need to do.
So we're seeing some video. I mean, look how beautiful this is. Does it differ if you're having a C-section versus a different kind of birth?
Same process. Process. You come in the front doors and head upstairs, and it's our job then to take care of you and direct you appropriately. But it's all the same doors, the same reception area.
Now, what if you get here and you haven't completely dilated yet? Your water maybe hasn't broken yet. Is there a special place that the women go?
Everyone goes to. So there is a women's assessment center, which is new. Ooh, there it is. On cue. So there's a women's assessment center where we can help decide if you need to stay in the hospital or if you can go home.
Because sometimes it can be confusing.
Trust me. This came up on Belly to Baby. I'm admitting to a lot of people that as an obstetrician, I had a few false labor situations when I was pregnant. I didn't know. Nobody knows, so let us help you. Come in to the very comfortable Women's Assessment Center, and we can help check your cervix, check baby's heartbeat on the monitor, and decide if it's time to come in, or maybe it's time to walk around a little bit for a recheck, or maybe it's time to go home.
Or if you're, while you're pregnant, I know sometimes things happen there, like, this is weird. I don't know what's happening right now. You're having spotting maybe or something. Can you come in there as well?
This is it.
Oh.
And effective March of this year, we will actually be seeing all of our gynecology patients and our obstetric patients in this Women's Assessment Center. So really bringing the whole service line together, so it's one place, it's easy, your doctor will meet you here, and it will be, for our patients, a way to bypass the emergency room and provide a little bit more boutique care.
So much better than Googling something.
Please come see us. I Google things. I'm not judging, but it never leads you to a place of confidence and hope. It leads you to
panic.
A spiral of panic.
Yes.
Yes.
Okay, so what if you come in and you are wanting a natural birth? Are there some options for women, therapeutic options for that?
Yes. So we are really proud of our tub rooms. So for management of pain in labor, we have rooms with really beautiful tubs, warm water, feels amazing when you're having labor pains. We do not, I need to say, we do not do water births here. We do not believe that to be safe in alignment with lots of professional societies. But anyhow, pain management during labor, tub rooms. We have a whole staff. I know.
I'm just distracted by how beautiful they are.
Look at the iPad. Look at the iPad. We'll talk about that later. But side note, you can order food and control your TV through your iPad. What?
Nice.
I know.
Nice.
I know. So we have labor and delivery nurses who are experts and the best of the best at helping you navigate pain, whether you want an epidural or not. There's ways to help position your body, walk. We have a labor walk.
Yeah, I just saw that. What's a labor walk?
Oh, there's a tub.
Yeah.
The tubs are nice and deep. They're really, really nice. So we have this hallway that's all glass, and along the hallway are beautiful original pieces of art from St. Louis and Missouri artists. And it's just a long space that is dedicated to women in labor who need to move. And there's a railing, so if you need to stop and catch your breath.
Yes.
But currently, we don't really have that capacity in our labor and delivery suite at Barn South. So there's the labor walk. So it's just a place to not be in a bunch of side traffic. Nobody's going to be pushing a cart by you. No family members going to be walking in circles looking for their loved ones. So that's just a space to kind of walk out those contractions.
And then there's also, this is for after, but there's a rooftop garden. I mean, there's all kinds of.
There is. We have an outdoor space with a garden. We actually have a view of a garden from labor, but you can't access it. But at least, the center of the unit is open with windows, and once spring comes, is spring ever coming?
Eventually.
I hope.
Eventually.
But once spring comes, there'll be flowers and greenery, and that's just more, light. And then up on the 6th floor, which is our postpartum area, you are able to access a garden and walk around and sit outside. Yeah.
We'll talk about postpartum here in just a minute, but let's talk a little bit more. We started out by talking about this partnership, but this facility is actually connected to St. Louis Children's Hospital, right?
Yes.
So talk about why that's so important and so special.
We have the capacity for one of our moms to walk. Oh, look at that operating room. I can't.
It's too exciting.
It's too exciting. Our moms can walk 100 feet, 100 and some feet across a bridge and be in the middle of the neonatal ICU. So this is an amazing reason, I think, for a lot of moms to come to us for their care if they know ahead of time that their baby's going to have neonatal ICU level needs when they're born. And it's also amazing for when that's a surprise.
Peace of mind.
You don't know if your baby's going to be born and need extra help. And if that's the case, you're a short walk away. And that is huge. Right now we're a couple buildings away, so we're short enough that it's a wheelchair ride, but this is just a matter of moments.
Well, and not to mention that if the mom is having to stay and the baby is having to stay in NICU, you're not that far away from baby.
It's basically like a hallway, but it's a hallway that happens to be in the air, covered in glass. But look at it. It's easy.
And I mean, that's incredibly unique to have something like that, because we're talking about 24/7 neonatologists that are on staff that can help, like you were saying, if something happens. And
whether it's an unknown or an anticipated, that proximity is so important for families and babies.
Yeah, wow. So, okay, what happens? We were just talking about postpartum. So, baby's healthy. What happens then? Where does mom go? What happens?
Yep, so mom recovers in this room. Well, not this room necessarily, but a room like this. And so there's some quiet time, mom and baby together, family members. We just want to make sure mom's safe and ready. And then it's a very short elevator ride up one floor. And there's a beautiful postpartum area with newborn assessment center is what you're seeing right now. So our pediatricians are able to check on babies that might need a little extra TLC but aren't ill enough that they need a special care or special nursery sort of level care. And there's also that garden we talked about earlier. Right. So you're able to get out of your room and actually feel sun on your face and fresh air.
And babies can stay in the room with mom?
Babies are with mom the whole time. I will say though, if mom is on a medication that makes her sleepy, if she doesn't have a support person with her, maybe everyone has to go home and help take care of the kids that are home, and it's just not safe to have mom with the baby by herself, or if mom needs sleep, they're able to go to that newborn assessment center and give mom a break. So we don't have a nursery, and I think that's been a little bit concerning for some folks, like Barnes is taking away a nursery. We're not taking away a nursery. We just don't have a big room where babies are parked for days at a time. We have this model where we want babies to be with the family, but if you need a rest, we'll take your baby so you can have a little bit of rest.
We actually have a question that goes to that support person. So someone's asking, what's some advice for fathers to be supportive, or the support person to be supportive to that new mom? Any advice?
As a mom and a wife or a doctor? What would you like me to answer?
Let's start with doctor, and then I want to hear the mom too.
Yes, so I think it's really hard for dads to find a space where they feel helpful. It's overwhelming. It's not something that you individually, personally have gone through health-wise, so it's really hard to know what to do. So I say embrace the not exciting, not sexy parts of life, like laundry and asking if somebody's hungry or thirsty and offering to pick up, take the diapers outside. I mean, in the hospital, we have so much help for you that really dads and moms don't need to do much. But you go home and you have this being that needs you, and all this stuff that is really hard for a mom who's just had a baby to do becomes like the most romantic gesture you could ever do. So as Valentine's Day is coming up, may I suggest that all the new dads embrace laundry and like folding it and putting it away in food. Now, there is lactation help. That was another question that just popped up. We have lactation consultants in the hospital.
That's so because that was a surprise for me. That was tougher than I imagined it to be.
Yes.
So
it is
so
not
nice
easy, and it is not anything to be ashamed of if you need help. And they will come see you automatically. You don't need to ask for a lactation consultant to come see you. If you identify as a mom who's nursing, they will include you on their rounds. And if you've done it before and you don't really need help, they'll just kind of say, hey, and go mom. And if you need help, they're there for you.
And that does that continue after you leave? Can you continue to call on them?
Yep. So we
that's
actually,
so nice.
I know. We actually,
you leave sometimes you think, what am I doing?
I'm alone.
Yeah.
So they will hook you up with folks in the community that have sort of a support group type situation. And if that's not your bag, if you don't want to sit in a group and talk about your breasts, no big. They will arrange for you to, they'll call you on the phone. They can arrange for you to come into the office. And I think it really does take a village, and they will connect you with folks in the community who may be a little bit more accessible and kind of tailor it to what you need. But they are 100% available to you once you go home.
That's wonderful. That's wonderful.
Yes.
We also have a question. If somebody wants to take a tour, how do they come and see this beautiful place?
Yes. So if you go to barnesjewish.org/classes, and you navigate a few pull-down menus to get to childbirth classes and then tours. I think those are the two menus. Check me on that, but it's very easy once you go to that barnesjewish.org/classes, you can schedule a tour.
We'll probably put a link within this so you can get to that easily.
And I will say the first couple tours that are posted are already full, and we're adding more, so keep checking back if you do want to take a tour in the next month or so and it doesn't seem like there's availability, we're adding more.
Okay, and just to remind everybody that this is currently not open.
No.
This Women and Infant Center opens on February 10th at 9 a.m. So this Saturday, my goodness. So exciting. And then we will have answers. We'll answer the questions in the comment section after the live video too. So keep with your questions. We'll continue to answer them after we're finished.
Sorry.
After we're finished. Okay, and then this also says, how long do you typically stay? So once baby has come, I know it depends, right, on what kind of delivery you've had?
In general terms, if you have a vaginal delivery, you stay for 2 nights. If you have a C-section, you stay for 3 nights.
Okay. I mean, so 2 nights, like if you have the baby in the morning,
right?
That's one.
Right. If you have your baby at 11 p.m., that doesn't count as the night.
Okay.
Yeah.
That's what I was curious
we don't kick you out.
So 2 nights, and what was C-section?
3 nights.
3 nights. Okay. Good. And during that time, that's where you're getting that information with lactation consultants and all kinds of things.
Oh, can I plug the family waiting area?
Yes.
Because this is new.
And that's the garden, right?
There's the garden.
Okay.
Imagine it with green. So the other thing that's amazing is we have an entire half of our second floor is a family waiting room. So we have coffee. We have computers with internet access. We've got refrigerators and microwaves. So for people who have folks from out of town that are sort of here for 8 hours waiting for the baby to be born, a lot of hospitals, including our old space, it was like, well, here's 2 couches and a bunch of blankets. But we now have reclining chairs and TVs, and it's going to make a big difference for support folks who want to be here but can't necessarily be in the room.
Yeah. Well, this is exciting. As we've talked about, this is something that doctors have dreamed about having for so long. And I mean, can you just talk about your excitement for Saturday?
I'll be really, really excited to wake up Saturday morning and know that all the planning, we have worked so hard to try to think of every detail to make everyone who is actually physically going to be moved comfortable. We've got snacks and coffee and t-shirts, and it's going to be such a rush to know that we did it and we're in this space, and we aren't going to move anyone who's actively in labor, I promise. We're going to make some, but it really is going to be quite a day of celebration.
Wonderful. Yeah. So again, this is the Women and Infant Center. It's located at Barnes Jewish Parkview Tower, a partnership between Washington University Physicians, Barnes Jewish Hospital, and St. Louis Children's Hospital. Something so exciting for our area to get because it's so special.
It is so special.
Thank you
so much. Come
visit
us.
Yes, come and schedule a tour. And thank you for answering all these questions. It's really interesting.
My pleasure.
All right. We'll see you next time. Thanks for joining us.